I've been asked to talk to you today about albumin to creatinine ratio, or as it's better known, an ACR test, and what it is. What it is, in its simplest form, is a urine test that we ask patients to do each year after annual review. The reason we ask them to do this is so we can check how a patient's kidneys are functioning due to their long-term condition or life-limiting condition, and how their medication may be impacting their kidneys.
Hi, my name's Maria. For people with a learning disability or any other cognitive impairment, even children, we need to use language that they use and understand. We need to keep it short, simple words and everyday language for them. So what is an ACR? In effect, ACR is just a water sample test to test the function of your kidneys.
In order to prepare for an ACR urine test, it is important that you keep being hydrated, keeping up with your fluids, making sure you're drinking plenty of water, avoiding things that could dehydrate you, such as drinking cups of tea, coffee, and alcohol. It is also important to avoid vigorous exercise 24 hours before taking the test, as this can up your creatine levels. But don't stop doing exercise, it's just vigorous exercise. In order to take the test, it's into a sample pot. Now this can be given to you before the appointment or during. So if it's before, making sure that you've done that, and if you can't, there'll be plenty of opportunity to do it in the appointment as well. So making sure you're passing urine and hand that to your nurse, or be prepared to pass urine at the appointment.
In simple terms, we need to get a sample of wee into a pot like this, and then it can be sent to a lab. You might need to get someone to help you, maybe a friend, a carer, or just someone you trust.
So why do we test ACR levels? In primary care, the ACR level is normally tested as it helps to identify kidney disease, especially in the early stages. The test is used to identify if there's an abnormal amount of a certain protein called albumin in your urine sample. The test is performed if you have any symptoms or signs of kidney impairment, if you have any family history of chronic kidney disease, or if you live with a chronic condition that might affect your kidneys in the long run, such as diabetes or hypertension due to the blood pressure medication that they're put on. For those living with a chronic condition, the ACR is normally tested annually at your GP review. This is to ensure that no damage to the kidneys is being done over time, and if any results come back abnormal or raised, then preventative measures can be put in place to ensure that no further damage is done to your kidneys.
Your kidneys help us get rid of waste in the toilet, help us monitor your blood pressure and look after our bones. So it's really important.
An ACR test can show us whether the levels of protein albumin are too high. This can indicate the early phases of developing kidney disease or even hypertension. It's not just confined to the above though. It can also tell us if someone's immunity is too low, someone may have a UTI, or even it could be to do with too much exercise. However, if a health professional is concerned, further tests may follow.
So the test will show if there's too much protein in your wee. But don't feel anxious or scared. Don't worry if that happens. We can just do another wee sample. The nurse or the doctor, they'll let you know what's happening next.
From a mental health perspective, being diagnosed with chronic kidney disease can have several effects on your mental health and well-being. It's normal to feel scared, anxious and worried, as it is life-changing news. However, it's important to talk to a healthcare professional to see what help is available to you. Being diagnosed with chronic kidney disease does not mean that you have to give up on your goals. It just means that you might have to change and adapt how you accomplish them.